According to the UN Population Fund, Uganda has the second youngest population in the world after Niger. Majority of Uganda's total population is under the age of 25, and this segment makes up for more than 7.3 million young people. The investigators in the study by the Makerere University School of Public Health contacted 2,500 adolescent boys and young men between the age of 10 and 24 years, both in and out of school in the 5 divisions of Kampala: Nakawa, Kawempe, Mwesigye, Lubaga and Kampala Central.
Most research that has been done has always started with age 15 onwards. So we tend to miss information on those aged 10 to 14. Now in this survey, one strong thing that we bring out is the fact that we are able to reach out to the 10 to 14, to listen to their voices, to be able to hear what is it that they are suffering from. Because without data, it is very difficult for program implementers, for planners, to know what to do.
Qualitative and quantitative data was collected on alcohol use, dietary behavior, illicit drug use, tobacco use, sanitation and hygiene, mental health, physical activity and sedentary behavior. Others were protective factors, sexual risk behavior, violence and unintentional injury, risk perception, adolescent health needs and the effects of COVID-19.
Being in school is associated with the protective behaviors because we see they are less likely to engage in sex, but when they engage in sex, it is more likely to be protected. To address alcohol use among adolescent boys and young men, it is important to also target what we call the secondary audience. These people they live with who normally influence their behaviors.
The study showed that 1,869 youth were in school. 771 have ever consumed alcohol, 289 have used khat, 263 have used marijuana, 384 have smoked tobacco, 620 spent more than 2 hours per day on social media, 1,495 have ever done an HIV test, while 26 were HIV positive.
Only 23.4% felt that they are always understood by their parents or guardians. That's a big problem. That's very critical in terms of these behaviors, because what we see in the other behaviors could actually be a result of this inattention.
According to the co-principal investigator, Dr. Joseph Matovu, the study found out a number of challenges which may hinder the productivity of the target group, and these included growing use of social media, sedentary lifestyles, inadequate housing, poor social capital, and no access to basic health services.
Cost of services, most health programs focus on girls and women, and no beds in some health facilities, and also the gender norms or cultural barriers that keep them out of these services.
Mwesigye, NTV.